Hello and welcome. I am Manish Anand. In the special episode of the Raisina Hills, I am joined by Tom Arms from London. He is an author, international relations expert, and a very senior journalist. And we are going to discuss a very sensational report that has come out in London, which was released last evening. It was about infected blood scandal, which went on for almost 3 decades, starting 1970s and going until early the 1990s. Tom is a widely acclaimed expert on the matters of international relations, and he has authored several of the books which have been bestsellers across the world. Welcome to the show, Tom.
Thank you very much indeed, Manish. I'm very pleased to be here.
Thank you so much. Tom, first and foremost, please give a brief idea what all this is about infected blood investigations, which went on for several years.
Well, roughly 30,000 people. It's roughly from 1970s, the early 1970s to 1991. 30,000 people were given infected blood, and about 3,000 of them died. Just to put it in perspective. And it has taken this long to get to the point where they're talking about some sort of compensation and recognition that, in fact, this even happened. The doctors, the clinicians, the politicians, the civil servants, for years were saying, oh, no, there's been no problem at all. We don't recognize it. And it wasn't until 2017 that Prime Minister Theresa May said, we have to have an investigation into this. Too many people have complained. Too many people have come down with either AIDS or hepatitis C, and this doesn't happen naturally. And so they launched an investigation under Sir Brian Langstaff, a senior judge, and he concluded that this is one of the worst scandals, the very worst scandal in the history of the National Health Service, and possibly one of the worst in modern British history.
So the update, I suppose, is that Prime Minister Rishi Sunak was supposed to express regret and announce compensation.
Yes, he has expressed regret, and tomorrow he may make a fuller statement in which he will talk about compensation for the victims. And they're talking about, say, £100,000 each for the survivors, of which there are about 3,000 survivors. I don't know. I have my doubts as to whether that would be sufficient. If I were them, and their lives have been ruined. I mean, a lot of them are now AIDS victims through no fault of their own. They are having to spend a lifetime on drugs and expect an early death because they contracted AIDS as a result of a blood transfusion given to them by the National Health Service.
Indeed, no compensation can be enough in such grave lapse of medication of patients. And Tom, when I was going through the report, I found that some of the victims or the patients were getting treatment just for road accidents. They had come for treatments for road accidents, and they were given infected bloods. And they,
yes, that's indeed the case. And it's where the blood was coming from, which is astonishing. They were importing blood. A lot of it came from American prisons, where the prisoners were being encouraged to donate blood. Well, of course, you're going to have a very high level of disease among prisoners who are, say, drug addicts or where you have in prison a great deal of homosexuality. And so you had an awful lot of AIDS-infected blood. And that wasn't stopped until very late in the day. They should never have imported it. And that is now recognized.
Indeed. Tom also runs a blog, observations of an expat, that is widely read and very popular, and the listeners should visit his blog and find out his perspectives on several of the issues. Tom, while we were going through the report, we found that efforts were made to destroy the evidences. The documents were destroyed. So there were attempts to cover up
Yes.
at the highest level.
Yes, no, that's absolutely true. Right up to ministerial level, apparently. A very popular politician. He's now a member of the House of Lords, Ken Clark. He is one of those who has been named as being responsible for the cover-up. But a number of senior civil servants, a number of senior doctors and hospital administrators. I mean, the reason for the cover-up is simple. They knew that if they were found out, that they would have to pay tens of millions, if not hundreds of millions in compensation. They didn't want to pay the money. They didn't want the finger of blame. I should add also, Manish, that this follows hard on the heels of another scandal involving sub-postmasters here in Britain, where a lot of them lost their jobs. Some went to prison because they're accused of stealing money when it was actually the fault of a computer system. And this took, again, decades to sort out, and a television program exposing it. And what it does, it indicates just a high level of incompetence and willingness to cover up misdeeds at the highest level of government here in the UK.
Tom, this report has come close on the heels of AstraZeneca admitting in a UK court that there were serious side effects from the COVID-19 vaccine. What is wrong with the health world? Why the pharma companies, why the health agencies are covering up? Why are they not honest?
Because they want to make a lot of money. And they don't want to have to pay compensation. They want to make the money, but they don't want to pay it out. I think that sums it up.
Yes, indeed. But aren't the people being used as guinea pigs in this
Yes,
whole
and
affairs?
in fact, they were using children for clinical trials for the infected blood, which was called factor VIII. So children being used in the clinical trials back in the 70s.
Indeed. In fact, Tom, I also wanted to ask you about factor 8 because while I was reading the report, even the doctors and the nurses persuaded the parents of the patients to take the drugs, as you know, by saying that they're wonder drugs and they would cure of the ailments. And this wonder drug is getting very popular. Even in India, the doctors prescribe wonder drugs without telling in details about the ramifications which may come to the patients.
Well, that of course is always a problem with any wonder drugs. They had a drug here in the 60s and 70s called thalidomide, which was given to pregnant women to prevent morning sickness. But when the children were born, it was discovered the major side effects that the children had deformed limbs of those who took thalidomide. Again, they tried to cover it up. They tried to say it had nothing to do with the drug, but it obviously did. And that wasn't a National Health Service scandal because the NHS was not involved in it, but it was very much a pharmaceutical company example.
But Tom, this infected blood scandal involves the National Health Services, which internationally is having very high reputation. That is taken as an example globally. So what kind of message does it send out to the world?
It sends out a very bad message, not only about the National Health Service, but about the competence of the UK government. And other than that, I don't know much. There are, of course, health scandals in countries like America as well, and they do not have the National Health Service. There, you have to pay a large sum of money for your health care, whereas here it is totally free. But the I don't know. What I can say is it is a scandal. A lot of people in America or countries where they do have to pay for the health service will claim this is a result of having a state-funded health service. I don't think you can say that. I think you can say that this is a result of having a health service where too many people are too concerned about covering their backsides.
Indeed. Tom, I would like you to throw some perspective on a bigger issue. That is about the connivance of the pharma companies with the medical professionals in recommending new drugs which may not have been tested enough. And this has also been exemplified in the report of the infected bloods. How serious is the issue, and what lessons countries like India should take from this?
Well, of course, India is now a big pharmaceutical producer. And so you have a great deal to gain from, if you like, short circuiting the various clinical trials which government agencies insist upon. But excuse me.
Sure.
But here in the UK, we have something called NICE, which is clinical trials. And there are a lot of drugs that in this country that are not approved in this country, but are approved in the United States, for instance, where I think there is a great deal more money that the pharmaceutical companies can make, in the United States than they can make here. And so a lot more money changes hands to get it into the doctor's offices. There obviously is there is a certain amount of corruption between pharmaceutical companies and clinicians and doctors, and it's a constant battle to fight against it. And you need scandals like this. You need things like this to be uncovered in order to prevent them from happening again. Of course, we all know, Manish, they will happen again, but let's hope they don't happen again too soon and not too often.
Indeed. It is also, Tom, very astounding that in a country like the UK, this infected blood scandal went on for 30 years. How was it possible? The media is so vibrant in the UK, parliamentarians are so vocal, still the scandal went on.
That is a very good question, and it is one that is being asked as we speak. I'm a journalist. I've worked in this country for 50 years as a journalist, and the media is not as powerful as it once was. And certainly it was quite powerful back in the 1970s and 80s, but it wasn't until the 1990s that it really became known and people started talking about it and seeking an investigation. And that coincided with the rise of the internet, a drop in newspaper revenues, and there really has been a dearth of really good investigative, there, I got it out eventually, investigative journalism in this country since the early part of the 21st century and the end of the 20th century. And we miss it. We need it.
Indeed. Because the principal role of the media is to expose such sort of scandals in the public interest. And
truth to power.
yes, speak the truth to the power. But that did not happen in the UK for 30 years, particularly in this matter. But there are a lot of victims who are still alive, and they have undergone a very hefty medical treatment because of the side effects and the complications.
Yes, and they haven't been offered any money formally yet. The judge, Sir Brian Lagstaff, who's headed up the inquiry, has suggested that they be compensated to the tune of approximately or on the average of £100,000 each. Um, and I think probably that will be the figure that Rishi Sunak puts forward when he speaks to Parliament tomorrow. Um, Now, whether or not the victims will accept that, whether they will appeal it, whether they will try and get more money and chase the government formally through the courts, remains to be seen.
Tom, I would like you to throw some light on the issue of transparency in the medical system, because the kind of ecosystem that we have, the patients are basically at the mercy of the medical professionals. So whatever they say, the patients invariably accept without asking too many questions. And in fact, questions are not even encouraged from the side of the patients.
Well, yes,
So what
it certainly is. It is a problem, and the medical profession tends to be very closed about it. So, for instance, if a mistake is made in the operating room, uh, the nurses working with the doctors are the only witnesses, or the anesthetologist may be the only witness to the surgeon's error, but they have to work with him day after day. Uh, and so, are they going to blow the whistle on him? Or will they, participate in the cover up? They can easily cover up because, as I said, they're the only witnesses. I had a friend back in the 80s who did an expose of this very issue. It involved a surgeon who was drunk and operated, and as a result of his being drunk, the patient died. And it was great difficulty getting anyone to say that this man had a drinking problem. Eventually they did, and my colleague won the Journalism of the Year award as a result. But it is an ongoing problem, and I don't think it's ever going to go away. Uh, the medical profession, we rely on it. It's important. They are full, in my books, the medical profession is full of heroes. Every doctor, every nurse is a hero, but in every group of heroes, there's a bit of a coward too.
Indeed. In fact, we took the doctors as demigods. We treat almost them at parallel with the gods, and we to them with faith. But now, in the age of commercialization, where the private hospitals have certain targets for the doctors in terms of the revenues. So, what precautions and what rights the patients should have, and that the government should work on to provide that sort of mechanism or architecture.
Well, I really can't help you there. I don't know what mechanisms they can do. Uh, I think the only thing is, when you do have a complaint in this country, they do have complaint departments, and they do have what's called a health ombudsman, who you can make your complaint to. And that health ombudsman is a government official, and they have the power to investigate your complaint. Now, that is, with fairly new. That's within the last 20 years that you've had a health ombudsman. And before that, you had to make the complaint to the surgeon who operated on you. And, that's a bit useless because he's not going to say, oh, I'm terribly sorry. And by the way, here's a check for £500,000. No, he won't do that. In America, the problem, they have malpractice suits. And so you have the legal profession effectively to protect you. And you have lawyers who chase ambulances and will, basically try to take every doctor to court. Now, that has gone a bit out of whack, because what has happened is that the lawsuits have become so huge, the awards have become so huge, that in some states, the malpractice insurance that doctors have to pay is so big that there's a shortage of doctors. They can't find doctors prepared to work in those states because if they do make a mistake, they have to pay out millions.
Indeed, it's a double-edged kind of a weapon. So you cannot insist on too much of transparency either from
Yes,
the
you
medical
can't.
professionals.
It's a win lose or lose lose almost.
Lose lose. But but what are the lessons or the takeaways from the infected blood investigations which are being incorporated in the National Health Services of the UK, that the similar episode doesn't repeat in future?
Okay, well, the first thing that this inquiry said is we cannot import blood from overseas. That is now a absolute no-no. No more blood being imported from overseas. The next thing is to improve the screening of all blood products, but also of pharmaceutical products. And and then I suppose, and this is not so much in the report, that we have to, and I don't know how you can do this, we have to make our civil servants, our administrators, and our politicians more accountable. And I think the only way that you can possibly make them more accountable is that they should be held accountable either financially or criminally for this current blood scandal in order to discourage people in the future from doing the same.
Indeed. In fact, Tom has given a very wide-ranging views on the infected blood scandal in the UK, and being a journalist for several decades, he has seen from his own eyes the working of the National Health Services, and he has given certain messages also that the press should be upfront in investigating public interest issues, that such cases should not linger on for 3 decades. Tom, it was very lovely talking to you. And I would request our listeners, that they should watch Tom in his shows and also read his books and also visit his blog. Thank you so much, Tom, for talking to the Raisina Hills.
Thank you, Manish.
Bye bye.